Thank you for tuning in to the San Antonio Express News Medicare panel discussion. This panel is intended to provide helpful information to San Antonio and the surrounding areas with their Medicare needs. This discussion is moderated by San Antonio Express News healthcare reporter Laura Garcia. Panel participants include Martha Rodriguez, the Executive Director of Medicare Plans and Network Management at Community First Health Plans, Oscar Abieta, an insurance broker at Texas Medicare Solutions, and Adriana Freeman, President and Principal at Medicare Marketplace.
Thank you, everyone, for joining us. So let's talk about Medicare plans and what the insurance landscape looks like for in 2023 in the Bexar County area. What can we expect to see this year?
This is the time of year when Medicare Advantage plans are announcing their plan changes for the new year, and plan benefits can change from year to year. So it's important that people with Medicare take the time to review what the plan changes are to their plan and reach out to their agent to also learn about what potential plan options that they have going into the new year. And some great news for people with Medicare is that this year in 2022, there is one company that has a 5-star rating, but for 2023, there will actually be 2 companies that have received a 5-star rating for 2023. So what that means is, all of these Medicare plans have a contract with Medicare, and Medicare rates them from 1 to 5 stars. 1 being poor and 5 being excellent. So for 2023, there will be 2 companies that have received a 5-star rating, which is great news. Overall, the insurance landscape is looking great for 2023. We continue to see the plans become more and more competitive and improve their benefits year over year, which means at the end of the day, the consumer is the winner. And 2023 is not any different.
Great. About how many plans can you choose from if you're living in Bexar County right now?
There are over 80 plus plans available to people in the Bexar County area. So lots of options. It can be overwhelming and confusing a lot of the times, which is why there's always an emphasis on people reaching out to their agent to really understand what those options are.
Absolutely. So what are some of the new shiny benefits available to those who opt out of traditional Medicare coverage and sign up for Medicare Advantage plans?
So one of the things that they'll be doing is they're putting more money for the groceries. So we did hear our seniors say that they're struggling paying for groceries, whether they don't qualify for Medicaid or if they do qualify for Medicaid. That is a continuous challenge. So getting more money for groceries, money for utilities to help pay the electricity bill, in some instances helping paying for rent. They're also going to continue to give money for completing physical exams, annual exams like eye exams, things of that nature. And also too, we do have an announcement as far as like the Part B is actually going down by $5.20. So that means next year's monthly premium for Part B is $164.90. So I'm pretty sure that's going to be quite helpful for most people. And then one additional thing I do want to mention is we do have a new PPO coming into our Bexar County that actually has no co-payments and no deductibles. So if that's something that you're interested in, obviously we're all here to help.
Great. So I'm seeing, go ahead, Oscar, I'm sorry.
Yeah, I'm sorry. Just wanted to echo everything that Adriana said. There's a need. People need that help with the groceries and even help paying those utility bills. And so there are some plans that are going to be covering those, offering those extra benefits. And other things, that we've seen in the past, are still going to be their gym memberships, the over-the-counter catalogs, nurse line, and even the personal emergency response system. Now, not all Medicare Advantage plans have all of these extra benefits. It varies by plan. I mentioned there's over 80 plus options. Doesn't mean that all 80 plans have all of these extra benefits, which is again why there's such an emphasis on making sure that you take the time to review your plan changes for the new year.
Absolutely. So, Adriana, I'm seeing promotions for Medicare Part C. What is this?
Okay, so Medicare Part C It actually came out in 1997, 99. And it was when Medicare was having challenges paying the claims because there was a lot of Medicare fraud back in those days. So they did come to some insurance companies. And we came up with, the insurance companies came up with the Part C, which is combining your Medicare A and B and your drug coverage all in one plan. Now, of course, we have some without the drug coverage, and we have some specifically for the people that are in the military, people that have a heart condition or diabetes. We also have those plans, especially for them. But if you have a PPO or an HMO and you're getting that through your Medicare, that's called the Medicare Advantage plan. And that is the Medicare Part C. So don't be tricked into thinking that you don't have the Part C. That's a new trick that these marketers are doing. They're saying, oh, you got to learn about the Part C. You don't have it. No, you do have it if you have a Medicare Advantage plan with the, so it's combining A, B, D into one card. So you only show one card to get all your services. That means you have the Part C.
Martha, can you break down some of the pros and cons between Medicare and Medicare Advantage?
Certainly. So I think as both Adrienne and Oscar have already mentioned, there's different types of plans that have different benefits. And in Medicare, both Medicare, Original Medicare, and Medicare Part C or Medicare Advantage cover the basics, which is hospital care and doctor's visits. The difference is that on the Medicare Advantage, you're going to get some extra benefits, as have been mentioned, like dental, vision, hearing. There's also specific Medicare Advantage plans that offer transportation to appointments. They offer food services, assistance with, even some plans are covering some home modifications, over-the-counter cards. The biggest pro with many members on the Medicare Original side is that you keep your doctors, because Medicare Advantage plans have limited networks. And so that's how you keep the costs down. You have the limited network, and so you may have to get authorizations for services, whereas in traditional Medicare, you may not need those pre-authorizations for specialty care. But, you know, on the Medicare Advantage side, you have all of these other services, and you don't have, you have a limit on the out-of-pocket cost that you pay. On Medicare Original, you don't have a limit. So you may be paying more. And so again, I think what we try and tell people is that you need to research all of your options before you make a decision.
So you brought up a really good point. How can consumers go about keeping their family doctor? If they have a doctor they've been seeing for so many years, how can they make sure that they can stay with them?
Well, as Oscar mentioned, there's so many plans out there on the Medicare Advantage side. So what you need to do when you're reaching the age that you're going to enroll in Medicare, you need to look at who your doctors are, which doctors you want to keep, and then start researching those plans. When you go onto Medicare.gov and when you go onto some of these websites for these Medicare Advantage plans, you can see their directory of providers. So you can decide based on that, am I going to join a Medicare Advantage plan because they have all the doctors that I want to see? Or am I going to stay in traditional Medicare because then I can see any doctor that I want, whether it's here or outside of the service area. And so that's a very important point that you need to research. You need to research everything before you make your decision.
I would imagine with so many doctors getting in and out of certain networks that those rosters can't stay completely current. So I've heard that you should probably go directly to your doctor and make sure that they accept that plan. Is that also a good option?
Yes, correct, because you're right. The rosters are continuously changing as doctors come in and out of groups, as they come in and out of plans. And so the best thing is to ask the doctors that you're seeing right now, are you in a Medicare Advantage plan? And if you are, which one are you in? Or do you not take Medicare Advantage and you're just in traditional Medicare?
Adriana, this question's for you. What are the deadlines and penalties consumers need to know?
Well, with Medicare, we have two penalties, the Part D and the Part B. And Part B is the part that pays the doctors, whether you're seeing them in the hospital, whether you're seeing them in the office. So sometimes people think they can go without getting the Part B because they don't want to pay the $170 per month. Well, we do have some plans that will help you pay that. And we can also find out if you qualify for some extra programs through the state, like Medicaid or the Medicare Savings Program that will help you pay those premiums. So if you're in those situations, definitely talk to one of us Martha has a great program down at the University Health Systems that will help you see what you also qualify. So if you're currently going there, we want you to remain there. And of course, they'll help you with that. But the penalty for Part B is a 10% per year. So of the monthly premium. So right now it's $170.10. So that penalty would be $17. And so naturally, we want to make sure you avoid that. And it's for the rest of your life. So you definitely don't want to get a penalty. Part D is for the drug coverage. And that's also, actually, you have to have that within 63 days of losing your credible coverage, whether that's through an employer or just that you didn't enroll when you were supposed to. So, and that one is per month, 1% of the average drug costs across the nation. So that penalty tends to go up and down. And so once you get that penalty, it's the same scenario. It's for the rest of your life. Unless, of course, you qualify for an extra program like low income subsidy, or you have you were out of the country. They have many different variations on why we can get that penalty waived. So that's why it's important to meet with someone local, whether it's at your local community center or whether it's with one of our agents from our agencies, with Oscar or our agency, or with the current agent you're working with. Maybe you ask them, is there something you can qualify because you are having trouble paying for those medications?
So those penalties that we're talking about, your consumers are penalized for not signing up on time or for not signing up on insurance at all? What are those penalties for? I'm sorry.
So the penalty is for not signing up. You have with Medicare Part B, they're not going to tell you have to take it at the Social Security office. However, if you don't take it, then the doctors cannot get paid. And so they're going to, naturally, that's going to affect your treatment options. The hospital is so you still have the hospital side, but the doctors, the anesthesiologists, everybody that comes in and sees how you're doing while you're in the hospital, that's covered under Part B. Plus the doctors that you see at the office, like the cardiologist and the pulmonologist and the primary doctor, those are all paid under Part B. So it's important for you to have the Part B. Unless, of course, you have VA benefits or you're employed and they're providing you with health coverage. The Part D is for the drug coverage, and you are not required to have it. But if you don't get it, you don't sign up when you're supposed to, you will face a penalty of 1% per month, which is actually a 12-month penalty per year. It is going to compound, and it is for the rest of your life. So you say, well, I don't take medications. Why should I have to pay for an extra program? I don't want it. I go to Mexico or I get it, with a coupon. Yes, I agree. That's a very good option for you. But with the Medicare Part C, we include the drug coverage and there's no monthly payments. So we're trying our best to help you avoid those penalties and also help you get all those extra benefits and keep your costs down. So it's important to talk to your local people, because that's one thing I do hear from our local community is, well, nobody told me. And so a lot of times people say, well, you didn't ask. So it's kind of like we're trying to find a happy medium to do these kind of things like we're doing today to get that message out for the consumer. So that way they know that even if they don't know what questions to ask, there are people there that will help them regardless if they know what questions to ask. We will ask those questions and get them into the programs that will give them the most and help them pay their costs.
So Oscar, can you tell me what are the deadlines? We're in October right now. So when does that start? When's that time period for me as a consumer to go and get Medicare and enroll?
October 1st is when plans can officially announce what their changes are for 2023. And when people can actually begin to make changes and enroll into different plans, it begins on October 15th. So it starts on October 15th and it ends on December 7th. So it's a small window that people have to take the time to review their benefits. And if they do decide that they want to make any changes to their plan, they can do so between October 15th and December 7th.
Good to know. Okay, so we talked earlier, Adriana mentioned about, and Oscar, about financial resources that folks might be able to be eligible for. Martha, can you tell us a little bit about that financial assistance? What's out there for the people who need it?
Sure. Well, there's a lot of programs that have more than just financial assistance. So for instance, the city of San Antonio, as well as Bexar County, they have senior centers that provide nutrition, they provide transportation assistance, they provide the financial assistance. They have sometimes some of these senior centers offer boxes of groceries for seniors that don't have enough food in the house or that need, some type of minor help. They also have exercise programs. In the summer, they have Project Cool, where you can either get a fan or a box air conditioner. Then, of course, you have the other services with Meals on Wheels, Catholic Charities, the Alamo Area Council of Governments with the Bexar Area Agency on Aging. They offer assistance for seniors that are looking at Medicare plans. So they're going to work through it with you and help you out. They also have benefits counseling. They have care coordination. They also have caregiver support. So if you're taking care of somebody as a senior and you need somebody to go in and sort of give you a little bit of a break, the Bexar Area Agency on Aging can help. And then you have your traditional sources like United Way, and 211 is a big resource because it's a 24/7 social services assistance anonymous hotline call that you can call in and ask for any type of resources that you may be looking for, and they'll give you a referral to somebody out in the community.
Such good advice. I've also seen, since we're talking about resources out there, Community First Health Plans has those really cool boxes out in the community and their pantries, so you can leave groceries and get groceries off of there, right?
Certainly the food pantries. It's an initiative that we started this past year, and they're located, like you said, all around the county. And it is, we start, by supplying them and we put the food in, but then the whole impetus of the project is to have then community people come in and start refilling them as they get depleted.
Such a cool idea.
Mm-hmm.
Okay, so Adriana, this question's for you. What about Medicare scams? What are some of the red flags, and how can we protect ourselves from being taken advantage of?
Okay, so that's a very good question. So one of the things is that people should not be coming to your house. That is so against the Medicare rules. And so if you got somebody coming to your house, that's a red flag. That's a big no-no. And the other thing is they're not supposed to call you. So if somebody's calling you, unless you ask them to call you, or unless you called the company and said, hey, I'm interested because I saw a commercial, or a relative told you to call this other agent that's not your agent, then that is, okay. But if they're calling you and then telling you you don't have Part C and you're missing out, then yes, that is scandalous. And that's what we mentioned earlier, the new trick that they're using is they're saying, you don't have all your benefits, you don't have Part C. So a lot of people didn't know what Part C was. So naturally they're buying into this new scam of not having the Part C. And never give your social security number. That's why Medicare changed the social security number off of your Medicare card. There's no more social security numbers, there's an encrypted number. And they did that deliberately because of all the scams. So you got to be real leery if somebody's calling you and telling you you don't have all the benefits you should have or need. How would they know unless they were your current agent? So there are some options there. You can go to donotcall.gov. And if you do it online, it goes really quick. It's within 72 hours, they put you on the do not call list. Or you can go ahead and go to, and I'm going to grab the number for you real quick. You can go to call in, because a lot of us do not use the web. So you can call 1-888-382-1222. That's pretty simple, right? 1-888-382-1222. Now that does take a little longer. It takes about 2 weeks. I did it myself because I want to make sure it worked. And I did it online, and you can register up to about 3 phone numbers. And I can tell you it did work. I'm not getting as many scam calls as I did before. So definitely, we find that San Antonio feels like it's under attack by these telemarketers, especially now with trying to buy your house. And they prey on our seniors that are maybe suffering because their income is not going up as the economy is changing. The gas is higher and food is higher, and they're not necessarily getting more money on their Social Security checks. So be careful with anybody calling you, trying to buy your house or trying to change your insurance. You definitely want to talk to your family members and include your insurance agent that you're currently working with, because they already know what doctors you're seeing, what medications you're taking. And once you change something, it does disrupt things. So you want to make sure that you're making the right decisions.
Such good advice. So, Oscar, can you tell me what are some of the advantages of working with a local insurance broker versus calling some hotline on TV?
Yeah, well, first off, it kind of ties in with what Adriana was just talking about. Working with somebody local, there's so much value in working with a local agent, because we do realize that there are lots of TV advertisements urging people to call these 800 numbers outside of Texas. And the truth is, these people may be licensed in all 50 states. And the difference with us is that we're local, right? We're right here. We're a part of the community. Our agents are here in San Antonio to serve our seniors. And we know the different physician groups here in town. We know which plans that they work with. We're able to really help our seniors understand what their options are and take full advantage of their benefits. And we do this at no cost to them. We're compensated directly by the insurance companies to be their agent. So there's so much value in working with the local agent. This will also help avoid any potential scams, talking to a complete stranger, working with somebody local who's right here. Tons of value in that.
Well, that was super helpful. Thank you, everybody, for joining us. And we really appreciate all this advice that you're giving us.
Thank you all for joining the Express News, our moderator and our participants on Medicare. If you would like more information about Medicare, go to www.mysa.com/Medicare.